Hello aspirants, welcome to GDC English classes. I hope you are watching our YouTube channel for daily purpose regarding updates as well as information regarding computer exams. So in this short video we will discuss about G proteins. The G proteins are the dictators of a drug action. So G proteins nothing but the receptor. Every receptor in the body they are inactive in nature. When they bind by the ligand molecule, the receptor become active. Like here also in the body, 60 to 70% receptors are G protein coupled receptors. They also known as serpentine receptors or metabotropic receptors or 7 transmembrane heptahelical receptors. When a ligand molecule binds to G protein coupled receptor, they produce 4 active G proteins. That 4 active G proteins like G alpha S, G alpha I R naught, G alpha 12 by 13, G alpha Q. If you want to remember any drug mechanism of action, you have to remember these dictators. First one is G alpha S, one of the active G protein G alpha S. When a drug molecule binds to G protein, it activates this G alpha S stimulatory. It increases adenyl cyclase enzyme action, leads to increased cyclic adenosine monophosphate level, a secondary messenger, leads to increased calcium concentration within the cell and decreases potassium levels within the cell. This leads to contraction. For example, adenine activate G alpha S on heart, produce cardiac muscle contraction. Coming to G alpha I inhibitory. So when any drug like propranolol blocks beta 1 receptors, activate G alpha inhibitory active G protein. So this leads to decrease in adenyl cyclase enzyme. This leads to decrease in cyclic AMP levels. This leads to decreased calcium concentration within the cell. This leads to increased efflux of potassium from the cell. So this leads to decrease in calcium and potassium levels within the cardiac muscle and make a relaxation of heart, decrease the heartbeat. So next G alpha 12 by 13. So this type of active G protein mainly helps in the exchange mechanism. This exchange mechanisms for transport of substance from one side of the cell to other side of the cell. So in even the diuretics at the kidney, this exchange mechanism will be there. For example, H plus potassium ATPase enzyme. H plus potassium ATPase enzyme. So here proton plus potassium exchange with each other with help of ATPase enzyme. So exchange mechanism under control of active G protein G alpha 12 by 13. And one of the other active G protein is G alpha Q. So when this G alpha Q active G protein is activated with help of phospholipase, it produces inositol triphosphate diacylglycerol, leads to increased calcium levels. This increased calcium levels may increase the release of neurotransmitter, may increase the release of hormones from the glands, and calcium is also regarded as a secondary messenger because of its number of actions. So here there are 4 types of receptors in our body like ion channel receptor, G protein coupled receptor, enzyme linked receptors, and nuclear receptor. Among these 60 to 70% receptors are G protein coupled receptor. So nearly most of the drugs they act by binding to this receptor. So most of our drugs like agonists they stimulate the G alpha S, antagonists they stimulate the inactive G protein. For example, morphine. Morphine produce analgesia by activate inactive G protein. By activation of inactive G protein. By activation of inactive G protein, they decrease the neurotransmission and produce analgesia nothing but pain relief. So these 4 active G proteins will are the dictators of drug action. So many of drugs are binding to these receptors and showing action, especially agonist and antagonist. And most of the agonists bind to these receptors. So these are the 4 active G proteins are the dictators of the drug action. So like this interesting and short videos regarding our competitive exam preparation. So follow and subscribe to the GDC English classes. Okay, all the best.